Talktainment Radio, worldwide sound. Talktainmentradio.com. We give you a reason to come. The world's greatest radio. We give you a reason to stay. Radio, the way it should be heard. You got the power.
The views and opinions expressed are those of the host and guest and not necessarily those of TalkTainmentRadio.com, the management, the staff, or K&E World Network, LLC.
This is the Wellness Spot, and I'm Tanya Karen. Wellness is a choice, is a choice, is a choice, is a choice. Wellness is a choice. TalkTainmentRadio.com. We go where you go. The world's greatest radio. Radio the way it should be heard. And you're in touch with the Wellness Spot. And I'm Tank the nurse. Here with Dr. EMAD MISAK. The doctor is in the station. So today, so we wanted to talk with you about anxiety. We suffer a lot from anxiety. A lot of times it has to do with the stimulation that is going on. There's a lot of extra stimulation by internet, by gaming, by stress in our lives, by TV, radio, just life in itself. Families, grandparents raising grandchildren, single mothers raising families, married couples raising families. There is just stress and anxiety. So I thought that this would be a wonderful topic to bring up. We're getting ready for spring. April is here, and we got the April showers going on. We're going to have some good weather coming up this week. So how do we help the brain with anxiety, stress, what I call inflammation of the brain? So we have the doctor here with us to help us. But before I do that, I wanted to mention a couple of things. We have a beauty school coming up for teens. And that beauty school is going to be on May the 5th. And it's for ages 10 to 17. So keep watching tankthenurse.com. Keep watching the Eventbrite, and we'll give you more details. There is a cost with this, but that's because the teens are going to go away with a nice gift bag. We're going to teach them how to cleanse their face, how to be beautiful, how to sustain beauty. And we have a wonderful instructor, Lula Nagash, that's going to help us with that. Next, I want to also mention that the doctor will be at the Wellness Spot on Wednesday. So on Wednesday this week, Dr. Ahmad and myself will be there to answer questions, to set up appointments. If you like the opportunity to see Dr. Ahmad, he will be there with his appointment book. We will give you some undivided attention, answer questions on information as it pertains to wellness. Because I'm always saying wellness is a choice. Yeah. Choose wellness, choose life. And it was so nice out yesterday that I hope some people went out and got a walk. We were with families, people this weekend that just passed. A lot of people spend time with family. They spend time cooking a lot. It's another one of those holidays where it's a lot of food and a lot of cooking. But the weather was beautiful that I hope that we got out there and did some walking. We're getting ready to start walking ourselves. And walking is very good for the brain and very good for anxiety. So let's jump right into this wonderful topic. Dr. Ahmad, I heard a statement yesterday. When I was at my theocratic meeting yesterday, there was this powerful statement that I just love and I want to mention. The elder, he said, you only die once. So why die 1,000 times in your mind with worry, guilt, and grief? So that's very powerful, and it leads to our discussion. You only die once. But so many people, either for different reasons, and we're not going to get into depression and things like that, but so many people die 1,000 times in their mind. So, can you tell me what's your definition, or what's the medical definition of anxiety?
This is a very important topic, anxiety, because we are living in era of anxiety. The prevalence of anxiety as a disease, according to the statistics of WHO, is like kind of 40 million Americans suffer from anxiety.
How many?
40 million Americans suffer from anxiety. And it's more in Egypt, for example, my original country, more percentage of people suffer from anxiety and depression. It's very important topic that we have to know how to deal with, but before we should know how to define it. Because there's anxiety and there is worry. What's the difference between anxiety and worry? Worry is a kind of worry is something normal, reaction. For example, when you are going to do a lab test, you are waiting for the result. It's normal that anyone get worried waiting for the result.
That's right.
A child or a candidate having an exam, he's worrying about the exam and about the result of the exam. But anxiety is a kind that people worry of some where there is no reason, rational reason to worry about.
Now, okay, let me back up there, because this is really good. So worry in that sense is when anxiety is when we worry when there is no rational reason to worry.
Exactly.
There's no test or exam that we're there's no threat of waiting on some results.
Exactly.
So, okay,
it's a kind like a man or a woman who suffer from anxiety is a people who is all the time restless, irritable, cannot relax, always waiting for something bad to happen. He's always waiting that maybe someone will die. He will have a disease. He will suffer from something. He will be poor. He will lose his job. He will lose his money. Although there is no reasons for that. Maybe he's working well. Everything is well arranged in his life. But he all the time he's worrying about something bad that will happen.
Wow. Now, the way you just described that, I actually know a lot of people that may have those symptoms and may not know that they are suffering from anxiety.
Yeah.
And I guess I have a question, because now my medical brain kicked in. The nursing side of me, the tank side is put to the side, but the nursing side, is it the parasympathetic or the sympathetic nervous system that also deals with that irritability, that restlessness, cannot relax?
Exactly. This is symptoms that we call psychosomatic, because anxiety can affect, one can suffer from chest pain, and he may think that he has a heart disease. And after doing all investigation, he or she finds herself or himself totally free. What's the reason of the symptoms? It's anxiety. It's psychological. It's his brain. It's your brain all the time when you are waiting for something bad to happen. Your brain will send negative signals to all your system. Every part of your body may suffer when you are feeling anxious.
Yes. That's kind of like, and I know we're not touching on that subject, but it's kind of like fear. Fear is only needed at certain times, and the body's response to fear is to speed up the heart rate, to slow down the digestive system, to increase the breathing so that we can run or do whatever we need to do. But it's on when needed and needs to be off when not needed.
Exactly.
With anxiety, if in our thoughts and in our brain and in our mind, we are worrying or we are having anxiety, it causes a physical manifestation in our body.
A physical manifestation and a permanent one.
Whoa.
Can you have it for good? But fear, you can have a kind of symptoms at the time of the fear. And fear is a normal process, normal reaction to certain circumstances. For example, if you are moving alone in the streets at night and someone with a gun say to you, your money or your life.
Yes.
Of course, you will get feared.
Right.
This is normal reaction. If you are here and the building, for example, start to collapse, we all gonna feel fear and gonna run.
Yes.
We all
Yes.
to save
Yes.
our lives.
That's right.
If all of a sudden a lion came here, all of us will shout and we'll get feared and we'll try to run. This is fear. But anxiety can be manifested by many phobias. And phobias is something different than fears. Phobias is abnormal fears. Is that like anxiety is you are worrying, where there is no rational reason to be worried.
Okay.
Fears or phobias is a kind of fear that you have fear while there is no reason to be developing fear. For example, there are many types. For example, claustrophobia is a kind of phobia and anxiety that some people may suffer when they are in closed small places.
That's right.
Like
That's
an
right.
elevator. Other type is agoraphobia, when you feel fear in open wild places. Other type of phobia is social phobia, when you're gonna meet a lot of people, or when you are, as me now, we are trying to speak while people are watching you. Some people develop like a kind of phobia and cannot speak well. There is other type of phobia or anxiety that is more for highly intellectual and philosophical people, which is called existential anxiety.
Okay.
People who think from where we came and where we are going to go. This may cause for many kind of people a certain kind of anxiety. So phobias is abnormal fear and is totally different than fear, which may be a normal process to react with some circumstances.
What, now I just learned something because, I always saw a phobia as a valid fear, but now the way that you explained it, I understand it. So when we have a phobia to either closed spaces or large spaces or social phobia, much different than that fear that our body comes to, like you said, when we have to react, run, or do something to help save our lives. Very different. So there are a lot of people that suffer from anxiety, and there's a lot of people that don't understand anxiety.
Exactly.
And don't see the realness of anxiety. Exactly. So can you tell me some types of anxiety?
Sometimes that I already said. This is agoraphobia is a type.
Okay.
Okay. Claustrophobia is a type.
Type of fear or type of, are there different types of anxiety that come with it, or is it just, those phobias can cause anxiety?
This kind of phobia
yes,
can cause anxiety. And you can have anxiety, for example, when you are going to a new place and you are afraid, do I need to use the elevator? I have claustrophobia. If there is elevator and is the 9th or 10th floor, I could not use climbing the stairs, so I should use the elevator, but I have claustrophobia, so I'm anxious, so maybe I'm trying to avoid the situation.
Yes.
Yeah.
Yes.
Yeah.
My sister.
This is kind of a phobias that lead to anxiety and exaggerate and exacerbate your anxiety and leading you sometimes to withdraw from many situations that at the end you can be withdraw from all your life. Some people get a phobia from getting out of their houses.
That's true. That's true. And I'm chuckling a little bit inside because I have a sister who does not like elevators a whole lot. So, I recall a time that we got on an elevator, and that's when I saw her anxiety.
Exactly.
She did not like that elevator, and it kind of caught me off guard, but that makes a lot of sense because if she has a choice, she's not going to go into a building that where she has to ride the elevator very high up.
Yeah.
So is there something that causes the anxiety? For example, I also have a son who at one point he would get anxiety when he would get in a car. Now at this time he had never been in a car accident, but he had anxiety when he would get on the freeway.
Mm-hmm.
So I really don't know what caused that, because again, he wasn't in a car accident. So is there always a cause to this anxiety?
Yeah, there are many causes that can lead to anxiety. There are, for example, genetic causes.
Okay.
Some people are born more liable than others to develop anxiety with little stress of life, with very little stressful situations, sometimes of genetic. And of course, environmental. Our history, our family history, the pattern of life with our family. For example, child abuse, whether physical or sexual, and that happens a lot, that may lead to anxiety later on in life.
Okay.
Other reasons that can lead to anxiety, for example, that in a certain situation, when you are a child, you develop like a kind of fear when you are alone, for example, at home,
Yes.
or when you are in elevator. Something happened, it's dark, the light is off, and a child develop like a kind of fear. This may lead to conditioning. After he's getting older, all the time, while he have to use the elevator, he will develop the same symptoms that he has it when he is a child. And also there are other reasons for anxiety. For example, who take drug. The drugs addiction can lead to anxiety.
Wow. Yes.
Even alcoholic addiction can lead to anxiety.
Now that right there is
yeah.
powerful.
Yeah.
So addictions can lead to anxiety.
Sure. And
Wow.
even when you are trying to be treated from addiction and make a gradual withdrawal from the substance that you are addicted for, whether, for example, heroin or alcohol or something, you may develop anxiety during your treatment to withdraw. And patients should know that they may suffer from anxiety and they should tolerate it until they can get rid completely from their addiction.
Wow. And you said another word that I picked up on. You said sometimes from conditioning. So like you said, by our life, our environment can cause anxiety.
Exactly.
And that can appear. So it's not abnormal for a person to be okay and to develop an anxiety later in life.
Exactly.
Because the reason I say that is because I do recall talking with a few people that were frustrated and even, I want to say, on their way to depression because people did not understand their anxiety.
Yeah.
Example, I just, a gentleman that had surgery. And after the surgery, because he had problems breathing coming out of the surgery, he developed an anxiety.
Yeah, sure.
And he had trouble sleeping and had a lot of anxiety right after that.
Yeah. Of course, this may happen. Of course. Yeah. Sometimes when you have a physical condition, physical, like, for example, asthma. When you have asthma and get dyspnea from asthma, this may lead later that you develop anxiety.
Right.
In this stage, for example, you need to be treated by a physical doctor and psychological doctor. You should take care of both the aspects of patient, physical and psychological.
Wow.
Yeah.
Wow.
And this is the same, for example, if you have heart attack, for example. If you have a heart attack and that causes chest pain, and after being treated, some patients are afraid that they may develop all of a sudden a heart attack.
Yes.
So they may be afraid to, for example, fly with aircrafts. He may have chest pain, for example, in the aircraft. He may be having anxiety from this. He will need to be treated physical and psychological also.
Wow. Now that too is powerful.
Yeah.
So not always, I mean, you're a doctor, so we need doctors, but that's very powerful in the instance of a heart attack or sometimes a illness or a condition that we deal with, we may need treatment psychologically to help with some of the complications or the after effects from that illness.
Sure. Most of the diseases, physical diseases, has psychological element, by the way. Has psychological element before starting. And after happened, there is psychological element that will increase if we did not take care of it.
Can I repeat that?
Yeah,
because
sure.
that just made a big smile on my face, because like I always say, every disease or condition can be traced to a thought or an emotion.
Sure.
And now what you're saying is, after you deal with the condition on the physical level, the psychological or the thought and the emotion can intensify or increase. So if we never take care of it, therefore we never get to the root cause of the issue. It's important.
Sure.
And I'm glad to hear that, because that's where we come with my love: essential oils, natural products, good food, clean eating, water, clear water, good drinking pure water, exercise, enjoying nature, because all of these things deal with the psychological.
Sure.
And they help tune up the body and help the body to repair.
Sure.
So, wow, that right there was all that was a lot, and that really makes me happy to hear what I say all the time. Now, we talked a little bit about causes, but tell me some symptoms, because like I said, when you mentioned earlier, a couple names of friends and family members came in my mind.
Yeah.
So there may be some people out here that don't even know that some of their physical things that they're dealing with is a result of anxiety.
Exactly. Anxiety, as I told you early, it can affect all your systems, all your body. For example, the heart. Anxious people can suffer from chest pain.
Right.
Chest pain.
Right.
Can suffer from dyspnea. They cannot breathe.
Yes.
Can suffer from palpitation. They hear their heartbeats loud in their ears, for example. They can suffer from a kind of asthma. I told you, when you have asthma, you can develop anxiety. And also anxiety can lead to asthma.
Wow.
Yeah.
Anxiety can lead to asthma.
Yeah.
Asthma can lead to anxiety.
Yeah.
Okay.
Also, a kind of cough. There is a kind of dry cough that can be very persistent and very irritating, and to the extent that one can think that he has cancer or something in the throat or larynx. And after doing all investigation, the reason can be anxiety and depression.
A dry, persistent cough.
Yeah.
Now, I got to just stop you just for a second, but I want you to continue. And the reason why I'm stopping you is because, I say a lot of times that people don't realize that the body is telling you things.
Yeah.
It's just that we don't understand what it's telling us. So let's take that dry, persistent cough. Someone would say, "Oh, I swallowed wrong." Or, they will try to explain it in so many ways, but still continue to have that dry, persistent cough. And that's not going to be the only sign, but I just guess I really want people to understand that the body is very good at telling us what's going on and giving us signs and warnings. It's just if we know what those signs may be. And that's really good. A dry, persistent cough.
Yeah.
What other kind of symptoms?
I want to make a kind of flashback, because you asked me about types of anxiety. I forgot to say two types. There is a type called generalized anxiety disorder and panic attacks.
Okay.
Panic attack, this is a kind when anxiety reaches its climax.
Okay.
It's to the top of anxiety. I remember this when we are talking about the dry cough or the throat, because panic attack is a kind of anxiety getting to the extreme. Well, the one can feel there is something in his throat. He cannot breathe. Something is trying to suffocate him, trying to putting his hand here, he cannot breathe.
Okay.
This is the top. This is the maximum stage of anxiety.
Wow.
Do this. And by the way, the kind of panic attacks sometimes happen while people are driving a car.
Yes.
Or
yes.
while, especially when are in highway or on the bridges.
Yes.
Because panic attack sometimes is associated with agoraphobia, which is the fear of wild places. And usually the highway is very many lanes. So sometimes people get fear from highways.
Okay.
And maybe sometimes I'm one of those people. But I'm trying to treat myself with the complementing modalities that we're going to talk about.
Okay.
And I go on with other systems that can suffer from anxiety. Your GIT, your gastroenterology.
Right.
You can suffer from heartburn, reflux, sometimes anorexia, you don't like to eat. Sometimes, on the contrary, you can have not anorexia. You want to eat a lot.
Right.
Hyperphagia. You want to eat a lot. Sometimes it may lead to diarrhea and constipation. A day of diarrhea and day of constipation may lead to irritable bowel syndrome.
Yes.
You can maybe lead to gases, and you feel yourself like passing gases all the day, and it may irritate you. You cannot stay near other people. It may irritate you. This can happen in GIT. Neurological system. Your neurological system can suffer from anxiety. For example, you can feel like kind of dizziness, blurring of vision, headache.
Yes.
It may lead to increase of blood pressure when you are anxiety uncontrolled.
Right.
This can also happen. Micturition, for example. Anxiety can lead to disturbance in your gallbladder, like a kind of spastic muscles of your gallbladder.
Oh,
sometimes, sometimes you feel you will need to micturate every half hour. And sometimes you feel like you want to micturate, and then you cannot micturate because there is spasm of your muscles of gallbladder because you have anxiety. And all these symptoms are terrify people, and they do a lot of investigation. And when they find everything free, they be recommended to go to a psychiatrist or psychologist or counseling or trying our natural products that I am sure that it help a lot.
Yes, because medication that affects with anxiety is very hard on the body. I mean, to me, all medication is hard on the body. But when it comes to the medication that is prescribed, it usually has an effect on the gut. And again, the gut has a lot of the same hormones as the brain.
Sure.
So sometimes there's a correlation as to why that happens.
Sure.
But you can feel worse before you feel better.
Sure.
Okay.
Sure.
So complications of anxiety.
Complications is very important because anxiety, if not treated well, will affect your systems and lead to complications also.
Yes.
For example, the heart. When you are having anxiety and you don't treat yourself, your heart, as I say, you may develop symptoms like palpitation, cannot breathe well, chest pain, and all these kind of symptoms are fake. You don't have anything in your heart. But if you not treat anxiety, with time, the accumulation of this kind of abnormal fears and phobias and worries, abnormal worries and anxious people, you may develop heart attack.
Yes.
You may develop hypertension. You may develop diabetes.
That's right.
As I said to you, concerning the chest, you may develop asthma. And asthmatic, you may develop asthmatic from psychological reason. When your stomach suffer from burning sensation, you may develop ulcer, gastric ulcer. And with time, your gastric ulcer may be malignant ulcer. For example, many other complications. For example, endocrinological, neurological, hormonal point of view.
Yes.
Anxious.
And so, we will discuss that further when we return. Anxiety and worry.
Sure.
Next on the Wellness Spot.
Robe is an intriguing, riveting, mysterious novel written on forgiveness by Renee Smith. Order your copy today at Barnes & Noble and Amazon.com. That's The Robe by Renee Smith.
For the best home fragrance and beauty products, shop Ash Kickin online.
That's ASHKICKIN.
Made with 100% natural quality ingredients and handcrafted with your family in mind, Ash Kickin products are better than those other guys. Ash Kickin candles, incense, body butter, face moisturizer, and hair moisturizer are priced just right, and you can get yours at 10% off with coupon code TALK17. Support this 100% Black-owned business and get your home and body smelling and feeling all right.
That's ASHKICKIN.
Shop Ash Kickin online at www.ashkickin.com.
Are you ready for a high school that allows you to work at a place that is right for you? Are you ready to earn a certification in healthcare, business, or manufacturing while achieving your high school diploma? Then you are ready for Life Skills High School, a free public school option for high school students 16 to 21 years old. Learn more about your free high school educational options at lifeskillshs.org or call them at 1-800-888-7992. Life Skills High School, education that fits your life.
I've got the water, energy bars, and camera. I think we're set for the hike.
Almost. We need to protect our skin. Don't forget your wide-brimmed hat and sunscreen.
All right. I've got the hat. I've got SPF 30. Will that work?
Yeah, anything 15 or higher is good. Just make sure it says broad spectrum.
Great. Got it. I am not getting burned again. Let's go.
Learn more at cdc.gov/cancer.
This is Al Edmondson, owner of a Cutter Brother Rest Barbershop. I'm calling on all barbers and beauticians. It's time for us to unite as one. We can serve our communities better together. Join the Ohio Black Barber Beauty Network. For more information, visit www.obbn.org or call 614-427-3226 to get more information. Be the change that you want to see in your community. Join our network.
If you or someone you know is abusing drugs and or alcohol and want to stop the abuse, contact APDS at 1409 East Livingston Avenue. Office hours are 9 a.m. to 8 p.m. daily and 9 a.m. to 3 p.m. on Saturday. APDS is certified by the Ohio Department of Mental Health and Addiction Services and primarily funded through the Adam H. Board. Fees are based on your income and Medicaid is always accepted. For more information, call 614-253-4448.
Every year, June marks the beginning of two busy seasons, summer and wedding season. If you are legally changing your name, you need to apply for a replacement Social Security card reflecting your new name. This is easier to fix now when you first change your name than years from now when you retire. So go to our website at www.socialsecurity.gov/SS number or call us at 1-800-772-1213, TTY 1-800-325-0778 to find out what specific documents you need to change your name and apply for a replacement card.
Live call-in talk show. Dial 1-877-932-9766 and join the conversation here on TalkTimidRadio.com.
TalkTimidRadio.com. We go where you go. The world's greatest radio. Radio the way it should be heard. And I'm Tank the Nurse. And Dr. EMAD MISAK is with us. Anxiety. Now, before we went on break, we were talking about complications. And one of the things that struck me when you were explaining the complications, my nurse brain kicked in again. Mm-hmm. And I, as a nurse, when someone comes in for me to do my assessment, mm-hmm. or for me to take their vitals before they come back to see the doctor, mm-hmm. what my brain just said to me was, there is no way for myself, for the person that is suffering from those complications, to know which is from anxiety and which is from a physical manifestation. They look the same, they affect the body the same. And like you said earlier, that goes to show how powerful the brain, our thoughts, and our mind is. Because, you know, you mentioned a person that could have anxiety, could have palpitations, they can have asthma, but not until all the tests are done do we realize that it's not from a physical problem, it's from anxiety. So were there some other complications? We talked a little bit about the heart, the asthma, the GI.
There are also neurological complications. When you are having anxiety and you don't treat it well, with time you may develop a stroke. For example, it may happen. And it's very, very well known that some people, after having a certain kind of trauma or something like that, and getting anxious and getting troubles and cannot control his bad feelings, will not seek a doctor to help him psychologically and emotionally, he may develop a stroke.
Well, now what just popped in my nurse brain there was stress. Stress kills.
Sure.
And so if what I just heard is anxiety can be so bad, or a traumatic experience accompanied with anxiety can be so bad that it can cause neurological problems that a person can have a stroke, can have complications from not dealing with those negative emotions, the anxiety or the stress.
Exactly. As I told you, first, when you have anxiety, you will complain of certain symptoms in all your body system, although your body are physically and organically free. But with time, if you will not control and treat your anxiety, these symptoms will turn into a real disease in your bodies, in your heart, your brain, your lung, your GIT. And there are more complications that I want to speak about it. For example, sexually. For example, in males in particular, anxiety can lead to premature ejaculation and sometimes can lead to impotence, for example. For females, this can lead to a condition called dyspareunia, which means pain during sexual intercourse. And other troubles from hormonal imbalance for females. For example, if a lady wants to be pregnant and she has a lot of anxiety, very anxious, cannot wait to have a child, this may interfere with her ovulation. And let ovulation, even if she took medication to induce ovulation. If anxiety will not be controlled, ovulation will not occur in a normal way and pregnancy may be difficult. If a pregnant woman develop anxiety, this will affect her child, her fetus, and this may lead to a problem in delivery later on. May lead even to abortion sometimes. If a lady has already a child and she's supposed to lactate the child, she may have not enough milk for natural breastfeeding for the child because of anxiety.
Wow. Anxiety, that right there was a lot, and that explains a lot. So anxiety in and of itself can cause complications throughout our physical body. And it also made me think of, I have a statement that I say a lot: daily use of essential oils make my body an unfriendly host to stress and bacteria. And from what you just said, if I can keep my stress and my anxiety, those negative thoughts down, my body will do better.
Sure.
My body can do what it's designed to do. It can repair, it can detox. But the buildup of stress and anxiety leads to complications. And this hits home a lot, especially this month, because in the last, I would say 60 days, I have had several acquaintance friends that have had extreme loss, and loss of people that were young in age. And when I say young in age, I'm saying under 70, under 60, some under 50, and even younger. And it just tells me how important it is for us to deal with anxiety. Now, I'm a person that, loves my essential oils. And I believe that by smelling essential oils, the atomic weight of the oils allows them to pass the blood-brain barrier, to pass through the olfactory bulb into the deep limbic system. It's about the size of 2 almonds, over covered by the prefrontal cortex. The essential oils can get in there and can relax, can relax the cells, can relax the person, and can decrease stress, can tune up the cells. There's some very good oils. We have a good one, Peace and Calm. So it's peace and calming. Stress away. It does just that. It helps to remove stress. Stress from road rage, from being in the car, stress from just life, from taking care of family, from our jobs. And we have a lot of other oils, lavender. But you have some other natural modalities that can help us with anxiety.
Yeah, sure. Natural modality, natural product for anxiety is very, very important. Why? Because the conventional or traditional medication for anxiety cannot be taken for good. Tranquilizers, minor tranquilizers, and sedatives, if it is taken daily for more than 6 months, it will lead to addiction, and then it will start not to be effective.
Wait a minute. Okay. You just, see, I think I might have been dealing with a little anxiety because you just hit me with a lot of knowledge. And then I got a little sad there for a minute thinking, wow, how important it is that we help ones with anxiety, with their thoughts, with stress. But now you say that natural products are the best way, because when we take medications made in a plant, a building, not medications that come from a plant, that these medications with extended use 6 months or more cause complications and then are not as effective.
Exactly.
Right?
Exactly.
Wow.
And this is different when we deal, for example, with hypertension or diabetes, because conventional medication for hypertension, for example, can lead to side effects, but we can take it for good, and it will not lead to addiction, and it can help to control blood pressure for good. But we need with it two natural product to counteract, to help more control, and to prevent side effects of chemical medication.
Okay, I got to say that one again. So, when we are taking our conventional medication, it is highly recommended that we do some natural things to help counteract the side effects and the complications from whatever that is. And again, let's take hypertension. So,
whatever the disease is,
whatever it is, we need to do natural modalities along with it. And it is proven. I have this wonderful book from Kirk Shabbat on medical aromatherapy, and one of the big things that he says in there, dealing with hypertension, diabetes, cancer, he says when you add to the allopathic medicine or the Western medicine, the medications, natural products, especially essential oils, the results are hundreds times better. There has actually there's never been any negative reports from combining both modalities.
Yeah. And something very great concerning essential oils, it does not interact badly with any other kind of medication without any kind of side effects. And in particular in anxiety is very, very, very important and very, very useful. And it may help people to get rid of any kind of chemical medications that really can hurt and cannot be taken, as I told you, more than 6 months.
Wow. Wow. I thought your first statement was going to wow me, but I think this last one has wowed me very much, because that is what people need to hear.
Yeah, sure.
People need to know that there is help, two, help without side effects, and there's relief. Because I'm pretty sure we have a lot of people that don't believe that they can get relief from the anxiety, other than not putting themselves in that position.
Exactly.
Like you said, those phobias, not going out to wide open areas, or not feeling comfortable in social settings. But there is things that we can do to help.
Sure.
That's good. That's good to know. What other treatments?
There are a convention treatment, but we're going to focus about the natural product.
Yes.
There are laser and acupuncture, which I all the time speak about it.
Yes.
Because kind of laser, as I told you before in another shows, is a kind of light with no side effects that when stimulate certain points in our body, in our hand, our neck, our back, our knee, can help stimulate points that can control the bad feelings, can help you to relax.
Wow.
Change even your brain chemistry. Brain chemistry, which is related to anxiety and also to depression, because one of the complications of anxiety is depression. Sometimes depression is something different than anxiety. Sometimes people having depression and with don't having anxiety, depression, a kind of mental disorder. But people developing anxiety, if not treated well, they may develop depression.
Wow.
Laser acupuncture can help both, can help treat anxiety and help treat depression by controlling and changing our brain chemistry.
Wow. That's another wow. So 3 times. Now, I wasn't prepared for that. So the low laser therapy can help change the brain chemistry.
Yeah.
That can help alleviate anxiety, because, I spoke a little bit about depression, but like you said, if anxiety left untreated, not only do we get depression, but we can get physical manifestations, and even, I'm going to say, death. Because if you do not take care of the anxiety can lead to complications neurological, in our cardiac system, in our GI system, that will then, left untreated, will continue to cause.
By the way, I forgot to say that anxiety can lead to arrhythmias in the heart. Arrhythmias, which mean abnormal heartbeats.
Right.
It can be all of a sudden increase or decrease. And this sometimes, if not controlled, can lead to sudden death.
Wow.
High pulse, and then sudden heart death.
Well, I saw someone this week, and their pulse rate was 140, resting. And, one of the things that I encouraged that person was, they don't ride around or have, it's available, but not everyone has equipment to check their vital signs. And there are vital signs because they're important to give us a snapshot of what is going on in the body. Now, if someone is breathing fast or their respirations are rapid, you can usually tell that, because you can see the diaphragm, or you can hear them breathing. But unless you feel the palpitations, This lady was resting at a heart rate of 140. That's like revving a car. The body cannot sustain that type of activity for a long period of time.
Racing,
with that, I told her it's like she was running a marathon. So that makes sense when you say that, if we continue and don't treat the anxiety, the stress that can be, we can get inflammation, oxidative stress, free radicals.
Sure.
And this is where the natural products, we talked a little bit about Micro Daily before. Taking Micro Daily daily.
Of course, it helps in anxiety and depression. I would like to remind people what I said before. Micro Daily, how much it can how it can happen, how it can help. What happens in our body, in our cell, from pollution, from chemical medications, from stress also, from psychological, from anxiety. We develop something called free radicals. What is free radicals? Our cell try to lose something called electron, lose this electron. So when the cell lose the electron, it will not be healthy as when they have its own electrons. And the free electrons will run on our body, and we call it free radical. What it will lead, this free radical? It will attack other normal cells to harm it, to make it aging, to destroy it, can affect all the cells of the body and affect any system.
You know how I describe that, Dr. EMAD? I say that free radical is like a narcissistic. It's a scavenger, and it's just trying to grab anything, and in its way, it's just trying to connect its electron, because it's missed one, with anything. So it kind of scavenges through our body, causing that oxidative stress.
This oxidative stress can be controlled by Micro Daily, because Micro Daily, as I said before, contains many vitamins and minerals, which had been Dr. Prasad, who is the leader of the team who invents the Micro Daily, had did in the research in paper, has been published a paper, many papers, that showed that he has 7 clinical trial on animals and 7 clinical studies on patients.
Wow.
And he has 7 patents from United States on the Micro Daily and its benefit on all your systems. Today you are speaking about anxiety, and I want to say that Micro Daily can control and dominate these free radicals and get the body get rid of it.
Yes.
So it will prevent healthy cells to be attacked again from these free radicals, and it will help cells that already has started to suffer because they lose free electron, which is a free radical, can help the cell to regenerate itself.
Wow. So in other words, it's like a protector that comes in, protects the good cells from oxidative stress, and then helps to repair the old ones. Now, I do know that it helps our body to create glutathione, which we need, the master antioxidant. But you know what I also say? When our cells get to where they are protected and they are ready to repair, that's where Micro Daily is excellent, and essential oils, because they can penetrate into the cells because of the small atomic size, and because they are made of carbon, hydrogen, and oxygen, which 96% of our body is carbon, hydrogen, and oxygen. It makes a great companion when those essential oils can come in, because one of the things about the deep limbic system, that is the seat of emotions.
Exactly. Yeah.
And we talked about how every disease and condition starts with an emotion and with a thought. So since essential oils can reach that area, and that area being the place for our response, it can send a message to our body that will touch every system.
Sure. And I think that micro daily and essential oils, each of them boosts the action of the others.
Woo!
Yeah,
Boost the action of the other. Yes, I like that.
Improving circulation, increasing immunity. For example, essential oils also, when inhaled, work on limbic system, as you said, and also decrease certain hormones, which is cortisol, that can be secreted from the suprarenal gland. And this hormone lead to anxiety and can lead to hypertension and diabetes, and I spoke about this last time. So essential oils help the body from many aspects with the micro daily that can get rid from the free radicals. Both of them do a perfect effect.
Kind of like the doctor and the nurse.
Yeah, exactly.
A doctor can see a patient on his own and do great. And a nurse can sometimes see a patient, and do the vital signs and do well. However, when you have a great nurse and a great doctor, you're almost guaranteed to have great care. Now, not forgetting, because you reminded me the last time, then we add to that a person that is at a point in their life to choose wellness. Because, we mentioned that the last time, the person has to first want it within, and it has to be part of that team. That team is the client or the patient, the nurse, and the doctor. And with the team applying good exercise, good nutrition, a good spiritual life, laughing, a good attitude, getting out in nature. Like I said, it's time to get out in nature. Good supplements. We have to have supplements just because, our food is depleted, our environment is depleted, and stress and anxiety hits us every day. So micro daily and essential oils can help combat that, can help reduce complications from daily stress, anxiety, and poor nutrition.
Sure. It's like kind of natural product. What I want to say, when you go to open area, when you are in nature, in mountain, beside a river, smelling a fresh air, you get a very good feeling that can encounter all your body. You feel that you are born again.
Yes.
When you are near the nature, you are far away from the stress, from the pollution, from the noise, and that's what the natural product who come from the nature. That's what exactly that will do inside your body. Feel all your body feeling relaxed. Your circulation, your mood, how you see everything is something better, something new, and that's what natural products do.
Well, I like that analogy. I'm going to keep that, if that's okay.
Okay, sure.
I'm going to keep that in my toolbox. Natural products touch every cell and every organ, every tissue, and every system in our body. Because I feel great when I'm outside. When I'm outside, if you're not careful, I'm going to yell, I'm going to scream, whether it's winter, whether it's spring, fall, rainy. If I'm in nature, I just feel amazing.
Singing under the rain.
Yes, singing under the rain.
Like Fred Astaire.
Well, I don't sing too well, but I do sing when nobody is around. That might be some anxiety. But that is good to know that when we use these natural products, that's how happy our cells can be. And nothing else can help our cells, because if you use what I call MESS, man-made, experimental, causes side effects, that man-made system, if you use products that have something that was put in it from a plant, and I mean a building or synthetic, it does not metabolize well in your body.
Sure.
And you mentioned that about some of the anxiety meds, you can only take them for a short period of time without getting addicted or without them being effective.
Sure.
But at least with the natural products, they're always effective.
Yeah, sure.
Always effective. And so we have you with us on Wednesday. I want to encourage people to come out to see about how to help their body with anxiety, with blood pressure, with diabetes, whatever comes up, to get on that road to wellness, to choose life, to try the natural products. It's worth the what if. You know, that's really how I feel. It is truly worth the what if. So we'll be at 4550 Heaton Road, Wednesday from 6 to 7:30. We'll be in the house with Dr. EMAD, and we'll be able to answer questions, set appointments, see people, and help them start their journey to wellness.
Yeah, sure.
Any other thing that...
I want to say that the nearer you are near the nature, the more you will be healthy.
Yes.
And I want to say concerning anxiety, if you will neglect it, it will destroy your body, it will kill you. But if you're gonna treat it from very early, at that early beginning, you will live healthy and you will protect all your body from all kind of diseases like hypertension and diabetes and many other, even cancers, that sometimes what they trigger them is anxiety, stress, and depression.
Thank you, Dr. EMAD.
Thank you, Lord. Thank you, Lord.
It's good to have you in the station.
Thank you.
Wellness is a choice. Choose wellness.
Sure.
Choose life.
Sure. Thank you.